What we want is people to be able to access services right at the time when they require them, and not just services but also information, because we recognise this isn't just about people coming into services, it's been able to be supported to provide, to be able to self-manage, so being able to give the right information at the right time to be able to manage people's own conditions. And in the right place is really about emphasising that inclusion. So where is the right place for people, and are people being excluded because of the way that we're providing services or information? So we need to think about that, whether it's digital, and can people access digital information? Is it in the right format? Geographically, are we providing rehab in the right place? So really a kind of broad sense of we need to get the place right and the methods right. And overall, it's about participation. It's about people having the choice to live the life they want to live. Since I launched the framework, just to say really briefly about this in terms of what we've done, we've set up a National Advisory Board, and it's great to have the Alliance as part of that. And Sarah's contribution to that is really valuable and welcome. So it's great to have the Alliance as part of that and working as partners in the work we're doing. We've worked on trying to decide what it is we need to do in terms of delivering that really ambitious aim, and we'll go on and talk a wee bit about that the self-assessment process in a moment or two. And just to say that we've tried to really engage with people, that this is about a partnership, this is about working together. So really it's about listening, hearing what people are saying, communities are telling us. So the process really is about that first step in, what is going on for people at the moment, for people who use our services, what's going on for people who are providing the services, and what's the message that you want us to hear. So in terms of where do we want to be, I think across the piece we're wanting to be providing good rehabilitation. And I guess just to make the point that when we talk about rehabilitation, we're talking about it in its really broadest sense. And hopefully when I was talking through the aim, you got a sense that this is not about people accessing a physio service, and it's not only about people being able to access a community rehab service. This is rehabilitation in its broadest sense. And we just want to emphasise the really important contribution to the third sector play in that, whether it's walking groups, and we've talked a lot about our kind of walking football. So lots of things that are provided in the community that might not overtly seem to be rehabilitation. We want people to understand that when we're thinking about rehab, it's really in that broadest sense. So we developed in partnership, so working with the National Advisory Board and others, we've developed what people are kind of telling us seem to be the principles for good rehabilitation. So you can see them on the screen, and in part I've kind of covered some of them in talking about the aim. I think what's really important for us is that rehabilitation is accessible, as I've mentioned, but it's realistic and meaningful. So it's not about people accessing a service, it's not about people having to fulfil the criteria for a particular service. I think what we're wanting to move to is a situation where we're actually listening to what people are telling us. What is their need? What are people telling us that their concern is? And what are the outcomes that people are really looking for? So it's more about a response to a need or a concern that's meaningful to the person. So again, going back to that idea of participation, what is it people want to do, and what is it we can put in place to support people to be able to participate in the life that they choose. So it may well be that part of that is physiotherapy or occupational therapy, but I think we would be looking for a much broader, a much more rounded approach that's absolutely tailored to the needs of that individual.
I won't talk through all of this because it's tons of text, but I mean we can share these documents if it's useful. But in terms of those principles, they can just look a bit like words on a screen, and I think for some of those words like easy to access, realistic, innovative, what does that actually mean in practice? So what we're intending to do is when we have projects and programs kind of under the aim, we will use these as measures. So actually, how do we know that we are achieving a service that is easy to access, or how do we know that it's delivered by a flexible and skilled workforce? And that's really up to the the projects and programs to decide once we're doing it. And it has to be kind of bespoke for each program because, well, obviously this is all relevant to an individual. So we've got descriptions next to each of those words there. And like I say, I won't talk through that and bore you all to death, but it's there to be seen. And we're hoping that when people are filling in the tool, they can kind of reflect on these principles and use that as kind of a benchmark to where we need to be. I think the next slide as well is just another one of these. Yes, so you can see there's a description next to each of those. And like I say, we're hoping to make those measurable. So anyone that's ever done sort of quality improvement or the likes will know that we will come out with outcome measures and balancing measures and things to actually prove the point that we're improving services rather than actually just making changes for the sake of making changes. So there's 3 kind of basic core questions in this programme. It's a very basic model of the 3 horizons. So where are we now? Where do we want to be? So that's like the blue sky, gold standard, blank sheet of paper. And then the bridge in the middle is, well, how are we actually going to get there? So that's the practical doing. And we're at the stage of, well, where are we right now? And without answering this, we can't really move forward. We can't solve any problems unless we really understand them. So we're kind of in this scoping, and I loathe to use the word scoping because I think people have scopitis. But actually we need to really understand what is happening right now because everything is in such a state of flux. It's constantly changing, guidance is changing, pandemic status is changing. So we need to really understand what's going on in all rehab services, groups, people as well. So we're doing 4 kind of key tasks as part of the scoping exercises. The self-assessment tool is obviously the big one, and that's really what we're here to talk about. And that is absolutely opinion-based. It's storytelling, it's listening to people that are delivering services. But on top of that, we do also need to understand the data. So like we want to be a data-driven program, and we want to understand the quantity of demand and actually what's coming our way. So you can use a bit of common sense approach, but actually what's happening in terms of all those conditions out there that need to access rehab, but also what's happening with the workforce. We know from constant headlines how challenged the workforce is right now. And that's only going to, that challenge is only going to get bigger over the next few years. So we really are extremely mindful of that. And that is obviously where the third sector plays a massive role. Mapping policy links, that's literally just about identifying the other projects and programs that are happening right now. I'm sure many of your members will be involved in things like the neurological framework. There's the realistic medicine program. There's all of the stuff happening in primary care. So if we don't identify those things that are already happening, we're at big risk of duplication, and we do not want to do that. And then the 4th thing, we've used the word targeting, on purpose, and this is about really targeting inequalities. We know now, and this phrase that is used all the time is COVID's shone the light on the inequalities that already existed. And I'm sure many of your members know this all too well and are probably funded in part by this, but we need to really kind of be brave with the inequalities work and actually start to target areas where we know are the people that are hardest to reach. So that's a piece of work that's happening across government and everywhere at the moment, but actually we're going to take a stand on that and really make that explicit within the programme. So the tool. So, I mean, like I said, it's opinion-based. I think it says on ours, it's like 4,000 characters, so it's many characters. They're open-ended questions. You can answer whatever you feel is appropriate. This is part of a wider scoping phase, so we're not asking people to go away and collect significant data. It's literally just how you feel as a service things have gone, and it's split into those 3 time phases. So pre-pandemic, and that's literally 2019 and pre, during the pandemic, and I appreciate that we are still in that phase, but when we talk about post-pandemic, we're talking about the next couple of years, so coming out of this situation. So please don't hold back. If there are concerns and risks, stick it in there. We would rather know. But also be specific. I think especially around the good stuff. If you are delivering something that you're really proud of and has worked, please tell us about it. And I think especially with this specific, with third sector agencies, we're going to be able to plug some of the gaps in health and social care with the work that's happening here. So if we don't know about it, we won't be able to do that. So yeah, please try and like toot your own horn kind of thing and tell us all the good stuff that is actually happening, as well as your concerns. We're going to bring all this together as part of the whole self-assessment tool. So just for information, this has gone to every NHS board, every health and social care partnership, leisure trusts, so local council. So this has really been sent to anyone that identifies as a rehab service. And as Beth's explained, that is vast. So we really have cast the net wide with this, and we are expecting to get a decent response back, because this really will influence everything that's done next. And I think my final slide is next. Oh yeah, there you go. So that's everything. And I think we'd be really keen to, if there are questions on the tool or on the programme, obviously we'd be keen to answer those, but equally, if there's things that you would like to pick up offline, Beth and I are both keen to chat. So thank you.
Well, thank you both, Beth and Bryony, for taking us through that and providing some of the, I guess, the context of where this work fits nationally, and also some of the ambitions and the hopes for the programme of work to implement the rehabilitation and recovery framework. I noticed that we have had a question already, or a couple of questions come in already, and it probably would be good for those people who are maybe going to be watching this recording back at a later point, just to touch upon this. And one of the questions is about the important role of people who are caring for loved ones, friends or family, and contributing to their recovery and their rehabilitation. And so the question that's raised is just that, this skilled workforce, it's really important that we also recognise people providing unpaid care. And there's no mention in what you've just taken us through about, that important role of that workforce, and also, I guess, people who are volunteers, who use maybe kind of peer support, and, whose work contributes, like you were describing, to helping people participate in the life that they want to live, but might not see themselves as rehabilitation. So just, would you have anything to say about, are those, are those kind of members of this workforce considered, and would you be seeking their comments as part of the scoping?
Yeah, absolutely. So I think we see the workforce as broad as it can possibly be, and actually so whether it's workforce, or as you say, whether people would think that they were part of a workforce or not, I guess. We're trying to be really inclusive. So actually, and look into the future, what is it we need? Who do we need, and where do we need? And actually, what are the training needs of individuals? So if there's a bit of that of society, if you like, of our community, that we need to have additional training, we really want to know about it. So we weren't meaning to be kind of exclusive at all when we were saying that. We really want people to look at that and think about it in its broadest sense.
I think that's a good point, and I think actually taking on board the use of the word workforce, maybe that's something for us to talk about, and just explore a wee bit more, because I can see why that would come across as we've excluded a certain group of people, but equally, I think the intention of the word was to make sure we, as Scottish Government and the whole system, if you like, are providing the appropriate resources for skills. So if carers feel that they need to have additional skills and things, where is that coming from? So I think that's a really valuable point.
That's really helpful, and actually, so important. I think what I've encountered from the discussions at the National Advisory Board meetings, that there is a real recognition that support and services that contribute to people's rehabilitation and or self-management. I think the way in which you describe rehabilitation strikes me that there's a lot of similarities to concepts like self-management and independent living, about helping people to live the best life possible and contribute in society in the way that they want to, and so I think it's really helpful when we get these reflections about who's involved in this, who has a stake in this, so those thoughts from yourselves are really helpful. We had another question, and I think there's maybe two elements to it. When we're thinking about kind of, right person, right time, right place, who is that really for? Is that from the perspective of the person and the outcomes that they're seeking to achieve? The person's just reflecting on the fact that at a previous experience, they were discharged from a service because it was seen that their circumstances were too complex for receiving that care. And does that kind of touch upon some of the aim that we're seeking from this programme about, everyone having the right to access the support and services that they need? And I also think if there's also any reflections, I know we've had conversations between ourselves about, making sure that we're involving people, in making sure that those improvements, like you say, Bryony, actually do lead to better to improvements and to changes. Any thoughts then about how we make sure that what we're delivering from the person's point of view actually does lead to those improvements?
I think that's a really good question, and actually something we talked about a lot when we were writing the descriptions of those principles was what does easy mean? Easy to access, and we had quite a big debate about using that word because there was a lot of concern around not including the word equitable access, but actually easy. So easy for Beth as the referring clinician is potentially different to easy for me as the person receiving the treatment. So easy is a really difficult word to measure. And I think when we get into the nitty-gritty of the project and actually delivering some of these pieces of work, we will absolutely have to be asking the people receiving the service if they found it easy and all those other things, so we're not necessarily going to ask every single person if they found it an innovative service, but actually it's really important that it's easy because all of the data suggests that people who don't find services easy to access are then not getting services and they're not getting the treatment and the care that they need. It's up to the person to almost identify to us if they found it easy, not us saying to them, well, we think it was easy for you to access. So yeah, I think that's a really good point, Maureen.
And I guess just so in terms of kind of whose outcomes is it we're looking for, and actually so in the same ways we didn't use the word equitable, we didn't use the words person-centered because we actually felt that was implied within everything, and actually the outcomes are the individual's outcomes. And so easy to access is easy for the person who uses the service, and this is what it's about. So that is the measurement in terms of it should be meaningful and realistic to the individual. It should be innovative and ambitious because actually that we're not just saying you need to fit into a service, but actually thinking a bit more broadly, a bit more laterally about how we can help that person, achieve their outcomes.
I think those are really helpful. 'Cause I guess what you're touching upon is that, this is complex service delivery, and that it needs to be, there needs to be different services available, and they need to be, operating at different stages in people's lives, and that they need to really work towards supporting personal outcomes, and how we communicate that might always be imperfect, but really what we want to do is have strong aspiration and some ways to measure that we are making those improvements, and helping people to have access to the support and services that they need, and I think the point that is being raised also speaks about how do we make sure that we have systems that can measure people's outcomes, and I think that's almost a question that's bigger than just this programme of work, and I know is something which the Alliance is very aware of and is keen to continue conversations with Scottish Government about. And the other thing that I know that you were speaking about in your slides was around, the importance of taking an approach which recognises that, different groups within, Scottish society will have been and have already been impacted differently because of the pandemic and before. And so we're very aware that health inequalities have been exacerbated during this. And I just wondered whether you would want to say anything about, I guess, where you see the rehabilitation framework kind of sitting within some of the work and the thinking around health inequalities. What are the kinds of needs that you're identifying? What are the kinds of situations that might have been worsened, or that you would want to kind of flag up? Is there anything else either of you would want to add around kind of the health inequalities aspect?
Well, I mean, I think there's lots of things we could mention, and the thing is, there's so much work happening around this. Everybody is kind of on board that we have to start to tackle this a wee bit differently. And I think just being really explicit and understanding those groups. So when we get responses from this self-assessment tool, as well as some of the very basic data of where health inequalities exist in Scotland, we know geographically there are certain places in Scotland that have significantly higher areas of deprivation. So what are the health outcomes of those areas? And there are entire agencies, Public Health Scotland, many people are investigating this. So we can take recommendations from everywhere, but the self-assessment still is almost like those people at the coalface delivering services to those groups of people can say, we need more, we need to do it differently, we should be doing X, Y, and Z. It's a chance to, I suppose, for us to be influenced in that sense. And I covered diabetes and respiratory, and I know, for example, that in diabetes, there's an issue with education. So delivering a diabetes education in other languages is a massive challenge. So we need to be explicitly tackling that problem and saying we will, look into investigating language barriers. That's one tiny piece of the pie, but in terms of rehab, it's so vast that we need to be told almost where are those pockets that we can say, right, we are explicitly going to tackle this as part of the programme.
That's great, thanks, Bryony. I think what really strikes me from what you're both saying is, we really, this is an opportunity for us to take a much needed stock take, I guess, if that's not too clunky a term, about what the kind of package of services and support looks like across Scotland to contribute to people participating in the best life that they feel they according to their feeling of what's their best life. And this period that we're undertaking over the next few weeks, where we're really seeking organisations, third sector groups, services, those that are supporting people through peer support, through a range of creative activities, nature-based activities, physical activities, emotional well-being. We really are seeking as many responses as we can to really understand what statutory services are contributing to people's rehabilitation and recovery, and importantly, what also the third sector provision looks like, so that we can, understand and learn and begin to kind of develop some programmes. It's one of those important opportunities just now for us to really hopefully get the message out there. And from the Alliance's point of view, it's great to be in a position where we can help coordinate some of this on behalf of the third sector. And so just to say to anyone who might be working in a third sector organisation or service, and they're considering, is this self-assessment tool for me? I would say yes. If you participate, if you support people to to help them live the best life for themselves, then yes, please, read through it, complete it and send it back to us. If you have any questions then please contact us. You can contact us at engagement@alliance-scotland.org.uk. Last thing for me is just to thank both Bryony and Bet for their time and for sharing with us some of this work, and for everyone who is going to be completing this tool, just thank you as well for your time and your contribution to this really important programme of work.